What's up, folks? In this video, this one goes out to all my EMTs, retired EMTs, active EMTs, non-employed EMTs. Like me. Yo, this message is for us, yo, because I'm about to hook us up with some very important life management skills if you got a parent or a loved one with diabetes, yo. That thing is so bizarre and complicated. And if we wasn't dealing with that Trump name-calling nonsense, the media could have been filled up with a lot of helpful information and resources with all these developments and inventions that's making the whole world easy. So this video is about diabetes and a loved one and us as EMTs and minor complications that goes along with it. So us EMTs, we respond to life-threatening situations. So we learn the protocols and, you know, we do our job, what we're paid to do. But when we go home, if we have a parent with diabetes, we didn't learn how to manage at-home diabetic care because it's not an emergency. So I helped out my pops like twice, and he had diabetes for like 20 years. So he's really good with managing his stuff because he eats healthy and he eats like herbs and like all that, like, not witch doctor, but like island Chinese medicine, ancient Chinese medicine. But he doesn't like medicine. But even though medicine is based on Chinese medicine, they just put it in a calcified form. But it's the same shit, really. But sometimes the medicine can be made potent, extra potent. So anyway, yeah. This was a weird situation, and if you get at least 30 days with your parent or your loved one, and you get a book, and you write down their blood sugar levels, their vital signs, like whatever the necessary assessment is needed for this medical book, you put it all in one book for a month, you're going to see like the trends and how to manage it with your family member. So today was a weird situation. I live in another house. My dad is independent. Like he walks and talks and he moves about on his own. And he lives in another house. So based on the past month, I've been taking care of him. And recently he's been having visual problems, so he can't drive, but he could walk, he could talk, he could move around, but the sun is shining into his eyes and it like hurts him, right? So he got to get sunglasses. He got those, so we're good to go. And we got the sunglasses from the dollar store because it's the one that covers like it's like Oakley's, but not really. It covers like the whole thing. Because some sunglasses, they sit and then there's a gap between your forehead. But these, they're like Spider-Man glasses. So they cover his whole eye. And he says it's good. So it was like $150 at the dollar store. And that was pretty good. But this situation was bizarre because my sister called me, or she texted me, and she said, Dad is having visual problems with his eye. He said he can't see. Like, you need to call him and check on him. So I called him, and I was like, you know what? We're going to the hospital right now. So I rode my bike from my house to his house, and then, you know, I took him to the hospital. So what happened was it was low blood sugar. It was 50, right? So he's trying to find a balance between his meals and his insulin intake. And that's one of the important things right there. The balance between the insulin and the meals. Because when you get that book and you do it, you're going to see the amount of calories that he takes in. And you could like help your parent or your loved one balance their diet. Because it has nothing to do with like this whole going on a diet, eating healthy, cutting carbs nonsense, right? For this specific situation. He's like extra thin. So he needs to build up the carbs, the fats, the muscles. He needs a full meal. So he's a grown ass man. And basically, that's one of the situations. You got to always make sure they're well fed, a diabetic person. And then the next situation is the difference between urgent care and emergency room. So these urgent cares places started popping up all over the place. And it was to assist with like bogus calls. And before I left, well, I never had experience going into the urgent care, like taking patients into the urgent cares because it was new. When I was an EMT, when Obama was in office, they started popping up all over the place. So now, one of the confusions I was having was like, where does he go, you know? So I don't really know where urgent care places are. I'm not familiar with it. So I just took him straight to the ER because his vision went blurry. When his blood sugar went down to the 50s, his vision became cloudy. So initially, I assumed it was high blood sugar, but it turned out to be low blood sugar. And, you know, we got the situation resolved. So I asked the doctor, I was like, in this specific situation, which would be more appropriate, the urgent care facility? Because I don't want to overwhelm the hospitals. Or is it the ER? So the doctor responded, he was like, based on his age, his condition, his history of diabetes, going to the emergency room was the proper decision to make. And basically, that's my emergency situation I had to deal with today. And if this helps out anybody, yeah. You're welcome. So that's all I got. Over out. Gotta go.